Stop for a moment, especially if you've been doing everything right with food, supplements, and strict routines, and your gut is still getting worse. If you live with bloating, early fullness, nausea, unpredictable bowel habits, or that heavy brain fog feeling, and your tests keep coming back normal, I want to say this clearly. You are not imagining it. But here is the safety line, especially for people over 60. If you have unintentional weight loss, persistent vomiting, blood or black stools, anemia, fever, new trouble swallowing, severe pain, dehydration, fainting, or confusion, do not treat this as a self-help problem. Please seek medical care promptly. Because gut-brain problems exist, and so do dangerous lookalikes. Today, I'll use a public story that many people have heard, Chuck Carroll's story, shared in long-form interviews, because it illustrates a common clinical pattern, severe gut symptoms occurring alongside high stress, uncertainty, and what patients often describe as a body stuck in fight or flight. Now, the medical framework. There is a real established category called Disorders of Gut-Brain Interaction, or DGBI. This term became standard with Rome 4 in 2016, replacing the older label Functional GI Disorders. DGBI refers to chronic or recurrent GI symptoms that are not explained by a clear structural disease on routine testing, and the mechanisms can involve motility changes, visceral hypersensitivity, immune and mucosal factors, microbiome shifts, and how the brain processes gut signals. So yes, stress can matter, but not because it's all in your head. It matters because the nervous system and gut are physically connected. When the sympathetic system is high, your fight or flight state, digestion often slows, sensitivity goes up, and symptoms can flare. The opposite branch, the parasympathetic system, supports rest and digest. Important nuance: you will hear people say stress shuts off blood flow to the gut. Physiology shows that under acute stress, like intense exercise or critical illness, blood can redistribute away from the abdomen and motility can change. But for chronic symptoms in real patients, it is rarely one single switch. So I will not tell you this one mechanism explains everything. That is not responsible medicine. Next, the "I feel drunk without alcohol" symptom. Cautionary: if someone feels intoxicated, confused, or unusually foggy after eating, there are rare testable medical conditions that can do this, like autobrewery syndrome or metabolic problems linked with small intestinal bacterial overgrowth in selected patients. These are uncommon and they require clinical testing. So please don't assume fermentation is the explanation. Assume it is a signal to get evaluated. Now, what can you do safely, especially if your clinician has ruled out dangerous causes and you are living with a DGBI pattern? I'll give you a supportive plan, not a miracle protocol. Step 1. Remove fear with facts and watch the red flags. Keep a simple symptom diary. What you ate, timing, stress level, sleep, medications, bowel pattern. Bring it to your clinician. This improves diagnosis and reduces unnecessary procedures. Step 2. Review medications and dehydration risk. Many common drugs can worsen motility or cause fogginess. Opioids, anticholinergic medications, some antidepressants, iron, and others. Do not stop medications on your own, but do ask for a review. Step 3. Calm the system with low-risk downshift practices. If you're steady on your feet, a gentle walk can reduce stress and improve mood. Nature exposure in controlled research has been linked with reduced amygdala reactivity after a walk, an objective marker related to stress processing. If you have fall risk, dizziness, chest pain, or severe shortness of breath, skip walking outdoors alone.
Choose a safe indoor option or walk with support. Step 4. Movement. Choose easy to recover from. If high-intensity workouts worsen your symptoms, consider switching temporarily to lower-intensity movement. Yoga may help some people with IBS symptoms and stress, but studies are mixed, and for older adults, it must be modified for joints, balance, and osteoporosis risk. If you try yoga, use a chair. Avoid extreme forward bends or twisting if you have osteoporosis, and stop if you feel dizzy or unwell. Step 5. Food strategy, only with the right diagnosis. Here's the key. Stop fiber is not safe as a universal rule. But if your clinician suspects delayed gastric emptying, gastroparesis-type symptoms, then a small particle, lower-fat approach and avoiding coarse, non-digestible fiber can reduce symptoms for some patients. If you're losing weight or struggling to eat, treat nutrition as urgent. Ask for dietitian support early. Step 6. Protect your circadian rhythm. Your body and many gut microbes show daily rhythms. Disruption of sleep and routines can worsen metabolic and inflammatory patterns, so focus on what is practical. Consistent wake-sleep times, regular meals, morning light exposure if possible, and reduced bright light late at night. Finally, the emotional injury that many gut patients carry. Being told your tests are normal can feel like being dismissed. A better message is your hardware looks intact, your symptoms are real. Now we work on function, and we do it step by step. If you relate to this, if you've been told it's all in your head, take the next step responsibly. Screen for red flags, get a medication and nutrition review. Ask about DGBI and evidence-based options like brain-gut behavior therapies where appropriate, and use low-risk calming routines as support, not as a replacement for care. I'm Professor Alexei Kalmykov. Stay careful with your health, stay skeptical of miracle language, and be compassionate with your body while you seek the right diagnosis.